Hello there, my name's Beverley Murphy and I'm the Director of Nursing at the Trust. And I'm really delighted today to have an opportunity to talk to you about the report that has been published following the Trust's CQC inspection across the months of July and August this year. What I'd like to do is two things. One thing is to take you through some aspects of the report so that you understand what it's saying about our services and our staff, your colleagues, and also I want to say grateful thanks to you, and that's where I'll start. The CQC inspections involve hundreds of people across the organisation, and at the same time that we're being inspected, you're working really hard to deliver a job that even on the very best of days is a challenging and difficult job. And even so, you gave your time and you showed your commitment, your dedication, your passion to the services and the service users that use them. And thanks to you, I'm really delighted to tell you that we have retained our good rating for our CQC, and that's good as a whole, as an organisation, and also our leadership under the well-led domain has been recognised as good. And that's all thanks to the work that you do every day. So what I'd like to do now is share a little bit of information with you about the ratings that we have attracted following the inspection in July and August of this year. Really importantly, I want to follow up my thanks with a congratulation to everybody across our services. In the caring domain, across all of our services, we are now rated either good or outstanding for every single service. So that's the caring domain. That's so important. It's so important that your work is recognised, and it's so important for people that use our services to understand the quality of our staff. So thank you for being consistently good and outstanding. So to tell you a little bit about the individual service lines. So let's turn first to the Lishman unit, which is our inpatient neuropsychiatry unit on the Bethlehem side. So the Lishman had a tricky time because they were the only service line that actually had an unannounced inspection, and they'd never been inspected before. So I think the service and its staff should feel particularly proud that they have attracted good in all 5 domains, which means they've got a good rating overall. So well done to all of you. The next service to mention is our inpatient eating disorder service, again up on the Bethlehem site. The staff there were a little disappointed earlier on in the year when an earlier inspection attracted some criticism. But they dusted themselves off, they did some learning, and this time round, again, they attracted a good rating across all 5 domains and therefore a good rating overall. So really well done to the team at the eating disorder unit. Next up, I'd like to mention the home treatment team and the health-based place of safety. We're very proud of those services. They have changed beyond recognition in recent years, and where previously they had improvements to make in safety, now those services have a good rating across the board, and that means that the rating overall for those services is good. Similarly, for our community services for older people in the community, previously they had a little bit of improvement to make, but they really got that bit between their teeth, and they've made the changes consistently since 2015. So they have a good rating overall. And I'm incredibly proud to say that in the domain of well-led, they have attracted an outstanding rating. Those ratings are not easy to come by. So they have done incredibly well. So another service that in 2015 was told it had changes to make, improvements to make, was our inpatient forensic services. This time round, once again, they impressed the inspectors with the improvements they've made consistently and across time, and in all 5 domains and the overall rating, they attracted a good. I'm absolutely delighted for the service who've been waiting for this inspection for a long time. So now to tell you a little bit about where the challenges are in our organisation. Specifically, what I'd like to talk to you about is the inspection of our acute care pathway. So that's 20 wards, and included in that is 4 PICU wards across our organisation. What the CQC told us is that the quality of care across those 20 wards is not consistent. There's too much variance. So they went into some wards where they found the care was very, very good, and they talked to us about some very committed and motivated ward managers. Unfortunately, the CQC also saw episodes of care where the patient's needs were not put first. Perhaps the attitude of the nurses was not what it should have been. Perhaps we weren't as proactive and as caring around physical health care, for example, following rapid tranquilisation, and so on. And because of that variance and because of the experience of some of our service users, the acute care pathway has got an inadequate rating overall. Really important to say that they've maintained their rating of good in the caring domain, but actually we need the service line overall to be good. Over the summer months they issued us with an improvement notice, and they were very clear in the improvement notice that they were giving us a period of time, so that's up until the 1st of April 2019, to make significant changes so that every service user across our acute care wards receives the best possible standard of care every day. That is, that they have a really good quality of experience and that they're safe, they're well cared for, they're respected, and they're cared for in a dignified setting. As a leadership team in the organisation, we want you to know that we're with you in making the changes, because what I and the senior management team and our leadership team as a whole feel is this is a real opportunity for us to make those changes. So for now, I want to finish by saying thank you. I realise that working during an inspection to deliver care is really hard work, and I know that everybody has done their absolute best. I also want to say on behalf of the board and the senior management team that we are incredibly proud of you, the work that you do, and the services that we provide. So thank you very much. Let's keep working together. Let's keep improving. Let's deliver our improvement plan, and let's be proud of everything we do every day at South London and Maudsley for the people that need our services.